Hi, my name is Jessica, and I'm a physical therapist. When I was young, I thought I wanted to be a veterinarian, and I kind of just made that decision probably when I was like 8 years old, and then just blindly followed that because in my head, thought I have a goal, I have a plan, it's something I'm good at. I eventually learned I didn't want to do veterinary, and I was a junior in college and was freaking out and didn't know what I was going to do, and just went to a career fair, and I ended up in food manufacturing, in quality control, a very traditional food science path. And it was fine for a while. I did that for about 5 years, and I just knew it wasn't resonating with what I wanted to do. I actually had a couple friends that are therapists that said, you should look into this. I think you have a good personality for it. You have the good skills. You're science-minded. You should give it a try. And so I started shadowing PTs, which is a requirement of most PTs to go to school. And I really liked it and just kind of dove head in and went for it. Physical therapy now, all doctorate degrees to go back to school. And you don't need a master's before you go. You can go from bachelor's straight to doctorate. And it's a clinical doctorate. So it's a DPT, Doctor of Physical Therapy. And so pretty globally, DPT programs are 3 years or like 2.5 with clinical education, didactic, in-person education. As a PT, you don't need any residency, you don't need fellowship, you get all that education. So once you finish the DPT, you can essentially start working in the field. On the flip side, I think something that's hard about physical therapy that I touched on before is the cost. I come from like a working class family, so I don't have familial support to pay for school. And when I made my choice in schools, I was partially limited by what schools I got into, but I also had to decide, do I want to go to like a cheaper school or a more prestigious, way more expensive school? But I think another thing, as like a Latina woman in physical therapy as well, it kind of calls back to like that underrepresentation within the field. I am happy to be someone that like represents that within physical therapy. On a day-to-day basis, working with patients, I only ever see it as like an advantage. It's like an extra thing that I have to relate with patients that helps build trust. There's a lot of things I really like about the field I work in. It's not partially, it's the reason why I chose it. The biggest one is working with people and being active. I always get a lot of face time with a patient, more than some other types of medical providers get. I get 30 plus minutes with a patient in order to really get to know them and work with them. The advice I would give to someone starting their career journey is mentorship, in my opinion. I think having a mentor, whether or not it's in your field, just someone that like knows you and is looking out for you, is extremely powerful.